Okay, let's unpack this. We have all had that moment. Maybe it was you, maybe it was your kid screaming at 2 in the morning, where an ear infection feels like the absolute center of the universe. We have all had that moment. It hurts, it throbs, and it just ruins your week. But generally, we think of it as feels like the absolute manageable misery.
But for the typical experience, yes, you get some antibiotics, you wait it out,
and life goes on. But generally, we think of it as
and because it's so common,
a manageable misery.
For the typical experience, yes, you get some antibiotics, you wait it out, inside that tiny space. We treat the ear, and because it's so common, we closed box.
But today, we are shattering that illusion. We are diving into a stack of lectures from ENT specialists that paint a very, very different picture. We are shattering that illusion. We're looking at chronic suppurative otitis media, of lectures from ENT specialists, and specifically, we're looking at a scenario where the infection doesn't just annoy you, it goes on a rampage.
That's a vivid way to put it, but it's medically accurate. We're talking about complications, and not just my ear still hurts.
It goes on a rampage.
We're talking about an infection. That's a vivid way to put it, but it's medically accurate. We're talking about complications, and not just my ear still hurts, and it can even create. We're talking about an infection that decides in your neck and face.
The phrase that stuck with me from the reading was the breakout. It sounds like something from a prison movie, but it's happening inside your skull.
It effectively is a breakout.
The phrase that stuck with me from the reading was the breakout.
If the conditions are right, the bacteria can find the keys, pick the lock, or just effectively is a breakout. The middle ear is
today our mission is to map out the extracranial complications. That means everything happening outside the brain cavity itself.
Exactly. We're not talking about brain abscesses or meningitis yet. That is a whole other level of terrifying we might get to another day.
Today's about the face, the bone,
we're not talking about brain abscesses or meningitis.
But before we get to the graphic details,
whole other level of terrifying we might get to another day.
Today's about the face, the bone, the neck, the balance system. But before we get to the graphic details, why does one person just get a fever and another person ends up with facial big question?
That is the million-dollar question. And the source material is very clear.
Why does one person just get a fever and another person
ends up with usually a perfect storm. That is the million-dollar question. Specific alignment of risk factors to turn a standard chronic infection into a spreading disaster. It is usually a perfect storm. It's almost like a recipe for. You need a specific alignment of risk factors to turn a standard chronic infection into a spreading disaster. Well, if you look at the demographics, it's almost like age plays a massive role. It follows this kind of U-shaped curve. The complications are most common in the first decade. Well, if you look at the demographics, age plays a massive role. And then the risk spikes again in the U-shaped curve.
And is that just because their immune systems aren't quite firing on all cylinders?
Precisely. In kids, the immune system is still learning the ropes. The anatomy is different. And in the elderly, the immune response is fading. But it's not just biology. In kids, the immune system is still learning the ropes and anatomy is different. And in the elderly, the immune response is fading. If you're living in overcrowded conditions, it's not just biology. You have the source of hygiene standards is poverty. You're constantly exposed to a major driver here. If you're living in overcrowded, it's about access to care. If you can't easily get to a doctor, a manageable infection is allowed to just fester. It's about overcrowding, poor nutrition, if you can't limited health get to a doctor, they create a manageable infection.
So the body is fighting with one hand tied behind its back.
Exactly. So you have a vulnerable host, limited health environment, and then of course there are the bugs themselves.
So the body is fighting with one hand. The lectures didn't just say bacteria.
So you have a vulnerable host and a tough environment. The virulence of the organism. And then of course there are the bugs themselves. We aren't usually dealing with your garden variety easy to kill bacteria here. Yes. The lectures specifically call out some heavy matters.
Like what?
We aren't usually dealing with your garden variety easy to kill bacteria here. The lectures specifically call out some heavy weaponry. Type 3 produces these specific enzymes, autolysin and hemolysin.
It's just sound like villains at college.
It's not just strength, it's weaponry. They're essentially chemical specific. Hemolysin destroys blood cells, and autolysin helps break down tissue.
So they literally dissolve the structure standing in the bacteria.
They're essentially chemical investigators. Precisely. And then you have Haemophilus, influenza, Pseudomonas aeruginosa.
So they literally dissolve the structure standing in the bacteria's way.
They clear methicillin resistant. And then you have Haemophilus, influenza, Pseudomonas aeruginosa. Exactly. So you have patients with low immunity, living in poor conditions, infected with a chemically aggressive superbug.
The ones that just laugh at standard antibiotics.
Exactly. So you have a patient with low immunity, living in poor conditions, infected with a chemically uncontrolled diabetes, AIDS, or those on chemotherapy. Their bodies just can't build the wall. Often uncontrolled diabetes is a huge one. Sugar-rich blood is basically fuel for bacteria.
There's one other factor the sources mentioned that really stood out to me because it feels so preventable. The role of inadequate treatment.
This is critical. It's the concept of doing just enough to hide the symptoms, but not enough to actually kill the bacteria.
Like painting over rust on a car.
This is a perfect analogy. The concept of doing just enough to hide the symptoms, but not enough to actually kill the bacteria.
Like painting over rust on a car.
Right. Perfect analogy. Knock the infection down, so the dose was too low. Maybe you don't knock it out. It lingers in the dark corners of the bone. It learns and it waits.
It turns an acute problem into a chronic.
But you don't knock it out. It lingers in the
So the
dark
infection's
corners
there.
of the bone.
It's angry and it wants to move.
And it waits.
I mean, the temporal bone is one of the hardest bones in the body, isn't it?
It is incredibly dense.
Okay, so the
but to a
infection's there. It's
persistent
angry.
infection, bone isn't a wall. It's just a very slow
The temporal
door.
bone is one of the
The
hardest
most
bones in
common
the body.
pathway is direct bone erosion.
Literally eats the bone.
In a sense, infection, bone isn't a wall. It's just a very slow door. You get a process called hyperemic calcification. Direct bone increases blood flow, which it changes the local pH and literally sucks the calcium right out of the bone. It turns hard rock into soft blood flow, which and in chronic cases you have something called cholesteatoma,
which is that cyst-like growth.
Yes, and it produces enzymes that physically digest the bone. It's a slow-moving mining crew, excavating a tunnel.
Which is that cyst-like growth. But the sources mentioned other highways too. Something about veins.
Venous thromboembolism mining crew. This is the Trojan horse method.
That's horrifying. But
the bone has plumbing system, these tiny haversion venous with microscopic veins. This is the Trojan horse dural venous sinuses and the veins of the brain. Plumbing system.
So the bacteria don't need to dig through the bone; they just hop on the subway.
That's exactly. They get into the bloodstream, cause a small infected clot and a thrombus.
So the bacteria
and that clot travels along these venous highways to distant sites. They get into the bloodstream,
and then there are the shortcuts,
cause a small infected clot, a thrombus.
Preformed pathways.
And these are anatomical glitches. It can be congenital, like a dehiscence.
And then there are the fancy word for a gap already there.
Yes, some people are born with these are anatomical glitches. It could be congenital, like a dehiscence, or it could be from trauma. Yes, an old skull fracture. Some people are born with tiny gaps in the bone of their facial nerve.
And scar tissue is not as tough as bone.
Not even close. It's a weak could be from or even previous surgery. If you've opened the door door surgically in the past, the lock is never quite as strong.
And scar tissue. So the bacteria have motive,
Not even
means,
close. It's a
and
weak
opportunity.
point. Or even previous
Now
surgery.
let's get to the crime
If you
scene.
open the door surgically in the
The
past,
sources
the lock
divide
is
these
never quite
complications
strong.
into
So the bacteria have motive,
temporal,
means,
let's start
and
intra,
opportunity.
inside the bone. Now let's get to the crime scene.
Intra meaning inside the
The sources
temporal
divide these
bone. The first and
complications
most
into
significant complication here is
intertemporal.
mastoiditis.
Let's start intra next door.
Yeah,
Mastoid is that hard bump right behind
intra
your
meaning
ear.
inside the temporal. And inside it's like the first and most significant complication now mastoiditis comes in two flavors.
Infection next
First
door.
you have
Mastoid is that
acute
hard bump right
mastoiditis.
behind
This
your
is
ear.
loud, aggressive, inside
Impossible
to come
The sources painted a very vivid picture of this. Specifically, the ironed out mastoid.
It's a classic loud, aggressive. Normally the mastoid bone feels
The sources
rugged,
painted a
but
very
in
vivid
acute
picture of this.
mastoiditis, the covering of the bone gets
Specifically, the
inflamed
ironed
and
out
swollen.
mastoid.
Its skin tightens over it. Normally the mastoid bone
And
feels
the
rugged,
and the ear
but
itself
in
gets
acute
pushed around.
mastoiditis, the swelling pushes the ear forward and down. You lose that crease behind the ear. It creates a very distinct iron juggy ear.
And the ear itself, and if a doctor looks inside the ear
swelling
canal,
pushes the ear forward and down. You lose that crease sagging of the posterior superior renal wall.
okay, that sounds technical. Break it down.
The mastoid air cells sit right above and behind the ear canal. When they fill with pus under high pressure,
Okay, that sounds
the
technical.
bone separating
Break
them
it
from the canal. The mastoid air cells
So the
sit
roof of
right
the ear
above
canal
and
is
behind the
literally
ear canal.
collapsing.
It's collapsing downward under the weight of the infection. The bone separating them from the canal fever, discharge,
So the roof of the ear canal is literally
because it's so
collapsing.
obvious, it's collapsing downward under the weight of the
But then there's the other flavor, the one that scares me
fever,
more.
discharge,
Masked
tenderness.
mastoiditis.
Because it's so obvious, right back to our talk on inadequate
But then there's
antibiotics.
the other
This is
flavor,
also
the one
called
that scares
latent
me more.
mastoiditis.
That's the sneaky mask.
Very sneaky. You take antibiotics for a few
right back
days,
to our
pain
talk
stops,
on
inadequate
inadequate
antibiotics.
You think
This
you've
is
won.
also called
have
latent
it.
mastoiditis.
You've just
That's
killed the
sneaky.
sensitive bacteria.
Very sneaky. You take
But deep
antibiotics
in the
for a few
honeycomb, the
days,
resistant
pain
bacteria
stops,
are still
fever
alive.
drops.
You think
They are
you've won.
slowly,
have it.
quietly eating
You
the
just
bone.
killed the sensitive
Sign of
bacteria.
destruction.
So how do you
Deep in the
spot it?
honeycomb, the
There's
resistant
no pain,
bacteria
no
are still
fever.
alive.
The clue is the eardrum.
They are
The
slowly,
source describes it as
quietly
thick and opaque. It loses its
Silent
normal
destruction.
pearly
So how do you spot
translucency.
it?
It just
There's no
looks
pain,
dull.
no
The
fever.
clue
That
is the
dullness
eardrum.
is the red
The
flag
source
that
describes
something
it
is
as
still wrong
thick
behind
and
the
opaque.
curve.
It
That is
loses its
terrible.
normal pearly
Okay,
translucency.
moving
It just
deeper into
looks
the skull.
dull.
Petricitis.
That dullness
This is
is
when
the
the
red flag
infection
that
reaches
something is
the
still wrong
petricitis.
behind the curve.
This is
That
a
is terrifying.
deep part
Okay,
of the temporal
moving deeper
bone
into
towards
the
the
skull.
center of the head.
Petricitis.
Now,
This
interestingly,
is when the
this only
infection
happens in
reaches
about
the
30% of
petricitis.
people. This is
Why
a
only 30%?
deep
Is
part
it a
of the
genetic
temporal
lottery?
bone towards the center.
Basically, yes. Only about 30% of people have
This only happens in
pneumatized
about 30%
petricitis,
meaning they
Why
have
only
air cells
30%?
there for the
Is
infection
it
to
a
move into.
genetic lottery?
But if you're in that
Basically, yes.
30%,
Only about
you can get
30%
one of the most
people have
fascinating
pneumatized
diagnostic
petricitis,
triads in
meaning they have
medicine.
air cells there
Carotid
for the infection
I
to
love a
move
good
into.
triad. Makes it
But
so
if
much
you're in
easier
that
to remember. What is
30%,
it?
you can
Okay,
get
sign
one of
number
the
one,
most fascinating
ear
diagnostic
discharge.
triads in medicine.
Sign number two,
Rodrigo syndrome.
I love a good
retroorbital
triad.
pain.
Makes it so much
A
easier to
deep,
remember. What
boring
is it?
pain
Okay,
right
sign number
behind
one.
the eye.
Wait,
Ear
an
discharge.
ear infection
That's
causing
it.
eye pain?
Sign number
It's
two.
geography. The
Retroorbital
inflammation at the
pain.
petrous apex is
Deep,
irritating the
boring
trigeminal
pain
nerve
right
ganglia, which
behind
is
the
right there.
Wait,
That
an ear
nerve
infection
sends
causing
pain
eye
signals
pain?
to the
How?
face and eye.
Geography. The
Incredible.
inflammation
And
of
the
the
third
Lateral
sign?
rectus pulse irritating the trigeminal nerve
They
ganglia,
can't
which
look
outward
right
with that
there.
eye.
That
If the
nerve
infection
sends
is in the
pain
right
signals
ear,
to the face
they
and
can't look to the right.
Incredible. And
The
the third
sixth
sign?
radial nerve
pulse,
which controls that eye muscle,
they can't
runs
run
outward with
outward
that eye.
with
If the infection is
swelling
in the right
just
ear,
pinches,
they can't
So
look to the
ear
right.
discharge,
The
pain
sixth
behind the
cranial
eye,
nerve,
and an eye that
which
gets
controls
stuck
that eye
over to the
muscle,
side.
runs right
Rodrigo
past the
syndrome.
petrous apex. You see that? You know the infection has traveled deep into
Ear
the skull base.
discharge,
It's a classic
pain behind the
aha
eye, and an eye that
moment.
gets stuck Now, over to the for side. something that might
Rodrigo
scare
syndrome.
people even more,
Exactly. You see that?
facial
You know the infection has
paralysis.
traveled deep into
The
the
idea
skull
that
base.
an ear
It's a classic
infection can
aha
freeze your face.
moment. The face
Now,
at risk.
for something that
Huge
might scare
psychological
people even
blow.
more,
And the mechanism
facial
depends
paralysis.
entirely on whether the
The idea
infection
that
is
an ear
acute or
infection
chronic.
can freeze your Okay, face.
The
let's start with
face
acute.
at risk. In acute cases, it's usually because of a
blow.
dehiscence,
And the
that
mechanism
natural gap in
depends
the bone.
entirely
The
on
nerve
whether
is sitting there
the infection is
exposed.
acute
The
or
middle
chronic.
ear fills
Okay,
with
let's start
toxic
with
pus.
acute.
In acute
The nerve
cases,
gets
it's usually
inflamed.
because of a
It swells up
dehiscence,
inside
that
its tunnel and
natural
just
gap in the
stops
bone.
working.
The nerve is
But the
sitting
nerve
there
itself is
exposed.
still
The middle
alive.
ear fills with
It's just
toxic
compressed
pus.
and angry.
The nerve
The
gets
prognosis is
inflamed,
actually
it
very
swells up
good.
inside
You
the
treat the
tunnel and
infection, relieve the pressure, and the nerve
But the nerve
usually
itself
right
is
back
still
up.
alive.
Yes.
But chronic cases
It's
are a
just
different
compressed
story.
and completely different.
Prognosis
In
is
chronic
actually very good.
CSM,
You treat the
especially with
infection, relieve the
cholesteatoma,
pressure, and the
the
nerve
paralysis
usually
isn't
right
from
back up.
swelling,
But
it's from
chronic cases are a
destruction.
different story.
The
Completely
disease
different.
is
In
physically
chronic
eating the
CSM,
bony
especially
canal.
with
It's eating the
cholesteatoma,
wire.
It's eating the
paralysis
wire.
isn't from
The
swelling,
onset
it's
is
from
insidious.
destruction.
It creeps
The
up on
disease
you.
is
And you
physically
can't just
eating
give
the bony canal.
antibiotics.
It's eating the
What's
wire.
the fix?
It's
It's
in
a
the
surgical
wire.
emergency.
The onset
You need
is
a radical
insidious. It
mastectomy.
creeps up on
The
you.
Solgen
And
has
you
to
can't
open
just
everything
give
up,
antibiotics
find the
for
nerve,
this.
and physically
What's the
remove the
It's a
disease from
surgical
around
emergency.
it.
And if the
You need a
disease has already
radical
gotten into the
mastectomy.
nerve fibers,
The Solgen
you may have
has
to
to
cut
cut
up that
section
section
into a
find the
graft,
nerve,
usually
and
taking the
physically
nerve
remove
from
the
the
disease
labrum neck
from
bridge
around
to
the
the
gap.
gap.
and if the
It
disease
is
has already gotten
serious
into the nerve
life altering.
fibers.
Then you may have to
So it
cut
had
up
bone
that section
destruction,
into a
eye
graft.
pain, facial
Usually
paralysis.
taking
What
the
about
nerve from the
balance?
Labyrinthitis. The infection reaches the inner ear. This comes in stages. First, you might have circumscribed labyrinthitis, often called fistula.
Fistula
Labyrinthitis.
labyrinthitis.
A small abnormal
infection
opening
reaches
to the
the
inner
bony
ear.
labyrinth.
This comes
Usually
in
a
stages.
cholesteatoma
First, you might have
against the
circumscribed
surrounding
labyrinthitis,
canal,
often called
often
fistula.
A fistula is a hole.
A small abnormal opening into the bony labyrinth.
The patient is
Usually
mostly fine, but if you press on their tragus, the little flap into the ear, or if they sneeze, they get a
How did that
sudden
show up?
violent
The patient is
burst of
mostly
vertigo.
fine,
Because the pressure goes
but
right
if
through
you
the hole
press on
into
their
the balance
tragus,
center.
Exactly.
the little
But if you
flap
don't catch
in
it there,
front of
it can
the ear,
become
they
diffuse.
get a sudden
And that
violent
splits into
burst of
serous
Because the pressure
and
goes right through the
suppurative.
hole into the balance center.
Serous is the
Exactly.
warning
But if
shot.
you don't
It's
catch it
chemical
there, it
irritation.
can become diffuse.
Toxins
And
enter
that
the inner
splits
ear,
into
but not
serous and
bacteria.
suppurative.
You get vertigo,
Serous is the
nystagmus,
warning shot.
the
It's
eyes
chemical
twitch,
irritation.
but it can be reversible.
Toxins
supurative.
enter the
Suppurative
inner
means
ear,
pus.
but not
The
bacteria.
bacteria have
You get
physically
vertigo,
invaded the inner ear
nystagmus,
fluids.
the eyes
This is
twitch,
the point
but
of
it
no
can be
return.
reversible.
The
And
delicate hair cells are
Suppurative means
destroyed.
pus.
You get
The
permanent loss of
bacteria have
hearing and
physically
permanent loss of
invaded the
balance
inner ear
functions.
fluids.
The inner ear is
This is
dead.
the point
It
of
is.
no
It's a
return.
tragic
The delicate
progression
hair
from a
cells are
small hole
destroyed.
to
You get
irritation
permanent
to
loss of
permanent
hearing,
destruction.
permanent
So
loss of
that
balance
covers the
function.
damage inside the temporal bone. But the title of this is extracranial complications. That implies the infection breaks out entirely. So that covers the damage inside the temporal bone. But the title of this is extracranial complications.
The
That
infection
implies the infection
erodes
breaks out
through the outer
entirely.
cortex of the mastoid and just
This is where we
spills
leave the
out.
skull.
Let's run
and
through the
start
rogues
talking
gallery of
about
abscesses.
abscesses.
The most common is the
infection
postericular
erodes through the
abscess.
outer
Right.
cortex of the
Postericular
mastoid
meaning
and
behind the ear.
spills out.
You get a
Let's
body
run through the
swelling,
rogues
the
gallery
groove
of
behind the ear
abscesses.
disappears,
The most
and
common
the ear
is the
gets pushed forward.
postericular abscess.
Looks like a jug handle.
Then
Postericular
there's the
meaning behind
zygomatic
the ear.
abscess.
You get a body
Zygoma is the
swelling,
cheekbone
the
area.
groove behind the ear
Correct. The
disappears,
infection
and
tries
the ear
forward.
gets pushed forward.
The
The
key
key sign here
Looks like a
is
jug
the
handle.
clinical
Then there's the
is
zygomatic
edema
abscess.
of the
Zygoma
upper
is the
eyelid.
cheekbone again with the
Correct.
eyes.
The
You
infection
have an ear
tries
infection,
forward.
but your
The
eyelid
key
is
sign
swollen.
here
It's all
is
connected.
clinical
If you see a
growth.
patient with a
Edema
runny ear and a
of the
puffy
upper
upper eyelid,
Again with the
think
eyes.
zygomatic abscess.
You have an ear
Pus is
infection,
tracking
but your
right
eyelid is swollen. Okay,
It's
now
all
this next one
connected.
sounds like a torture
If you see a
method.
patient with a runny ear and
Bezold's
a puffy upper
abscess.
eyelid,
Bezold's
think
is a
zygomatic
deep neck
abscess.
threat.
Pus is
The
tracking
infection breaks through the
Okay,
very
now
tip
this
of the
next one sounds like a torture
mastoid at the
method.
bottom. It
Bezold's
leaks out and gets
abscess.
trapped
Bezold's
inside the
is a
sheath
deep
of the
neck
sternocleidomastoid.
The infection
That's the
breaks
big
through the
muscle on
very
the side
tip
of
of
your
the
neck.
mastoid.
Exactly.
At the bottom.
So the pus
It leaks
tracks
out
down
and
that
gets trapped
muscle.
inside
The patient
the
gets
sheath
swelling
of
in the
the
upper neck. The
sternocleidomastoid.
hallmark sign
That's the
is
big muscle on the side of your neck.
a rigidly
Exactly.
stiff neck.
So the pus
They
tracks
hold their
down that
head
muscle.
tilted
The
towards
patient
the
gets swelling in
side
the
and
upper neck.
refuse to
The
turn.
hallmark sign
The
is
muscle is in
torticollis.
spasm because it's
A
bathed in
rigidly
pus.
stiff neck.
And it's dangerous
They
because it can
hold their
travel.
head
It can
tilted travel down into the chest, and it's incredibly dangerous.
It is
The muscle is in spasm.
Then we
because
have a
it's
couple of
being
oddly
compressed.
specific dangerous because Luke's abscess.
It can travel down into the
It's an abscess in the
incredibly
external ear
dangerous.
canal itself.
Then
The
we
funny
have
thing
a
is,
couple of
there's no
obvious
destruction of the mastoid
Luke's
bone.
abscess.
The pus
Luke's
travels
is
under the
unique. It's an abscess
periosteum
in
and
the
just pops up in the
external
canal
ear
And
itself.
Titelli's
But
abscess.
the funny thing is,
Titelli's goes the other way
destruction of the
backwards.
mastoid
The pus
bone.
tracks along
The
the
pus travels
posterior
under the
digastric groove into the occipital region, so you get a
And
painful
Titelli's
swelling
abscess.
effect.
Titelli's goes the other way
Finally,
backwards.
parapharyngeal and
The pus tracks along the
retropharyngeal
posterior
abscess.
digastric
These come from the
groove to
peritoneal cells
occipital
around the
region, so you get a
eustachian
painful
tube.
swelling
They're
effect
dangerous
as
because they are deep in
Finally,
the throat space and
parapharyngeal
can
and
compromise the
retropharyngeal
airway.
abscess. So we've gone
These
from a
come from
simple
the
ear
peritoneal cells
infection
around the
to
eustachian
abscesses
tube.
behind the
They're
ear,
dangerous because
in the
they are
cheek,
deep in
down the
the
neck,
throat
back of the
space
head,
and compromise
and deep in the
the
throat.
It
So we've
creates a
gone
map
from a
of
simple
destruction.
ear
The infection
infection
simply
to
follows the path
abscesses
of least
behind the ear.
resistance.
So when you step back and look at these
back of the
lectures as a whole,
and
what's the big
It creates
picture?
a map of
The synthesis
destruction.
here is
The
that
infection
CSM
simply
follows
follows
the path
path
of
of
least
least
resistance.
resistance.
It is
So
not
when you step
static.
back
It is
and
an
look at these
active
lectures as a
biological
whole,
process that
what's
is
the big
constantly
picture?
looking for
The
a way
synthesis
out
here
in
is
the
that
ear.
CSM
It's relentless.
It uses veins, it is not enzymes to eat bone, it finds the cracks in our anatomy, it is absolutely relentless.
And it feels like the
It's
theme of
relentless. It uses
mastoiditis
veins, it uses
is the most
enzymes to
critical
eat bone,
warning.
it
Absolutely.
finds the
That is
cracks in
the
our
key
anatomy.
takeaway.
It is absolutely
In the era of
And it feels like the
antibiotics, we
theme
don't
of
see the raging obvious
mastoiditis
complications as
is the
often.
most
We see the
critical
subtle
warning.
ones, the
Absolutely.
masked
That
ones.
is the
The
key
silent
takeaway.
ones.
Yes.
In
In
the
the
era
era
of
of treating an
antibiotics,
infection
we don't
just
see the
enough to
raging
hide the
obvious
symptoms but not kill the
complications
bacteria
as often. We see the
cannot
silent
be
ones.
overstated.
The masked
A
ones.
silent
silent
ear
ones.
can still
Yes.
be a
The
danger.
danger of
It
treating an
makes you look
infection
at a
just
prescription
enough
for
to
a
hide the
10-day
symptoms
course
but
of
not kill the
antibiotics.
bacteria
Very
cannot
different.
be overstated.
You don't stop at
A
day
silent
5
ear
just
can
because
still
you
be
feel
a
better.
dangerous ear.
Exactly.
It makes
If
you
you
look
stop
at a
early,
prescription for a
you are
10-day
leaving the
course
door
of
open for that
antibiotics.
perfect storm.
Very
You are
different.
inviting these
You don't stop at
complications
day
back
5
in.
just because
Well,
you feel
we've
better.
covered the damage to the
Exactly.
face
If you
to the
stop
neck and
early,
balances.
you are leaving the door open
But
for that
here's a
perfect
final
storm. You are
provocative
inviting
thought
these
to leave you
complications back in.
We spent this whole time
we've covered
talking
the damage
about
to the face, the neck,
extracranial
and balances.
complications. The infection
But
here
here's
is
a
outlet.
final provocative
Right,
thought
into
to
the
leave
safe
you.
zones, relatively
We spent this
speaking.
whole
But
time
the ear
talking
is
about
also right next to the brain.
cranial
The
complications.
roof of the middle
The
ear
infection
is
is
the
moving
floor
outward.
of the brain
Right,
cavity.
Into the safe
If
zones,
the infection can
relatively
eat through
speaking.
bone,
But the ear
to
is
the
also
neck.
right next to the
It
brain.
can certainly eat through
The
bone
roof
to
of the
get to the
middle
brain.
ear
And that's the
is
elephant in the
floor
room.
of the
If
brain
the
cavity.
infection takes the path
If the
upwards
infection
instead of
can
outward,
eat
we are not
through
talking
bone,
about
to the
abscesses
neck.
in the neck.
It
We're
can
talking about
certainly eat through bone to
meningitis,
get to the
brain
brain.
And that's the elephant
abscesses,
in the room.
and
If the
lateral
infection
sinus
takes the path
thrombosis.
But
upward
that, my
instead of outward,
friends,
we are
is
not
a
talking
deep
about
dive for another
abscesses
day.
in the neck.
For
We're
now,
talking
take care of
about
your ears,
meningitis,
finish your
brain
antibiotics, and
abscesses,
respect
and
the
lateral
anatomy.
sinus
Thanks for listening.
thrombosis.
But
Stay
that, my
curious.
friends, is a deep dive for another day. For now, take care of your ears, finish your antibiotics, and respect the anatomy. Thanks for listening.
Stay curious.